presentation, you can ask some questions, but let there be wait a moment for someone to come up to copy sign your question so that everyone who's watching on the live stream can see the question as well. And thank you so much to our presenter this morning, Rie, for coming and talking about Medi-Cal and Medicare and some changes that may be happening in the coming year. So I'll give the floor to you. Take it away. Thank you.
Well, thank you very much for having me today, and Happy New Year to everybody. So I am going to talk about understanding your Medicare and Medi-Cal benefits today, and my name is Rie, and I'm a high-care counselor at the Center for Healthcare Rights, and I'm also the community education coordinator. And before we start the presentation, I wanted to talk about a little bit of our organization. So Center for Healthcare Rights is a non-profit organization, and we provide free Medicare and other related health insurance counseling and advocacy services to Los Angeles County residents. Our services are funded by California Department of Aging, Health Insurance Counseling and Advocacy Program, also known as HICAP, HICAP. And our phone number is listed here, 1-800-434-0222. And if you have any questions about Medicare or Medi-Cal, please give us a call. Our business hours are from Monday through Friday, 8 a.m. to 5 p.m. And you can go to our website, healthcarerights.org, to check fact sheet. We have many fact sheets uploaded there, so maybe before you ask any questions, you can check out our fact sheet to see if your questions will be answered. I say this because when you call us, you need to make an appointment, and your questions won't get answered right away, so you may need to wait for like a week or 2 weeks for the appointment time. So please check our website. Okay. So I just wanted to show you this. So if you have Medicare already, you receive Medicare and You booklet, and in the back of the booklet, you see call this number if you have any questions about Medicare, and it's us. So what I wanted to tell you is, so we are not part of Medicare, but we work with Medicare, and we don't sell anything. We don't recommend or endorse any particular plans. So we provide information so you understand how the systems work that's the difference between Medicare and Medi-Cal. Any questions so far? Yes.
We have a question from the audience. So Medicare disability or permanent disability, what does that mean exactly? And
Income, what's the limit?
what's the limit
For Medicare.
So,
for Medi-Cal?
okay, so, sorry, the question was, if you have, Medi-Cal, and if you're receiving HSDI, what's the income limit?
No.
No, if you have a job and at the same time you have Medi-Cal, what is your income limit?
What is the income?
1 second while we copy sign that for the live stream.
Okay, so.
So one moment, sorry, Ria, we're gonna repeat that for the live stream.
Oh, you work.
So if you're working and what's the limit for your income for Medi-Cal?
So, let me show you, sorry, I'm going fast forward. So, this is the current income limit for Medi-Cal. However, if you have disability status, if you are receiving SSDI still, you can apply for another program, another Medi-Cal program. It's called 250% Working Disabled Program. And with that program, income limit is much, much higher. So if you have any questions, you can give us a call. But there is another program that you can apply for. And with that program, if you're single, income limit was about $3,200 a month. And if you're a married couple, I thought it was like around $4,000. And the thing is, if you have earned income, means you work and you get paid, Medi-Cal doesn't count 100% of that income as, toward their income limit. They count about half of it. So say if you're making $3,000 because Medicare started with A and B only originally. And A and B, they don't give you prescription drug coverage, so you need to join one of these, C or D, to get your prescription drug coverage. And C and D are offered by private companies that have contract with Medicare. And C is also known as Medicare Advantage Plan, and it's usually bundles all Medicare benefits, A, B, and D. And D covers your prescription drug only. So it works with, they say, it works with original Medicare because it covers prescription drug only and it doesn't bundle everything. And let me see. Okay, so I will talk about the difference in a bit between C and D. So now I want to talk about the Medicare cost. So for many people, for majority of the people, having Medicare Part A is free. So basically, if you can receive SSDI, Social Security disability benefits, or Social Security retirement benefits, then your Part A is free. And Part B, on the other hand, everybody has to pay monthly premium. And this year it's $202.90, and each year this amount changes. And you may hear about late enrollment penalty, like you must pay a penalty if you don't join Medicare at the right time. So Part B is the one that incur penalties if you don't join Part B at the right time. And it's a lifetime penalty, and it's 10% of the premium for every full 12-month period. You could have had Part B coverage, but you didn't. What that means is, so like say, at age 65, you are healthy, and you thought, oh, I don't want to pay for this premium. I'm not going to join Medicare Part B right now. Then, like at age 68, you went to the doctor's office and you unfortunately got diagnosed with some kind of illness. And then you thought, oh, I need to join Medicare right now. Then when you try to join Medicare, first of all, like if it's in June or something, you go to Social Security and tell them, I want to join Part B. They say, oh, you need to come back next year during the general enrollment period from January to March. That's the time you can join Medicare if you don't have special enrollment period. So you go back in January to join Medicare Part B. And at the time, Social Security will say, oh, you should have joined Medicare Part B at age 65. Now you have penalty. And like say, this person is 68 years old. He may have like 20% or 30% of penalty because he didn't have Medicare Part B for like say 36 months. Then his penalty is 30%. If his duration, the length of the time he didn't have Medicare Part B was like say 20 months, then his penalty is 20% of that year's Medicare Part B premium. So it can be very expensive, and it's not just one-time deal, it's lifetime, as long as the person keeps
understand that $283 amount. So like, for example, can you explain that to me, the deductible?
Sure. So it is, say in January 7th, you went to see a doctor because you had a flu symptom. And doctor's office will charge you, like say $100. You must pay $100 out of pocket because insurance is not covering you yet. Once you pay $283 out of pocket, then Medicare starts covering your benefit.
Is that new or has that been going on?
It's been around forever.
Okay.
Okay, yeah. Any other questions? Yes?
Another question from the audience. So if I were to get Advantage, like through Blue Cross, for example, would that help with the $283 deductible?
Great question. So, sorry, I was gonna talk about the difference between the C and D, Medicare Advantage plan and prescription drug plan right now. So I want you to wait a little while. Okay. All right. So we talked about different drug coverage. Medicare Part C, that's Medicare Advantage plan, and Medicare Part D, that's prescription drug plan. So the differences of these two parts are, first one is Part D, that covers your prescription drug only. So it works with original Medicare. What that means is you can go to any doctor you want, you can go to any hospital or any facility you want, as long as they accept original Medicare. And more than 90% of doctors and facilities in the United States accept original Medicare. And if you have original Medicare, you don't need to have a referral to see specialists. Medicare covers medically necessary services. There is no there is no prior authorization process. So it can give you more flexibility in terms of which doctor you can go to, and also maybe you can get services much quicker than having Medicare Advantage plan. But it can be very expensive because you need to pay 20% co-insurance, and you don't know how much exactly that is because it's a percentage based. It can be 20% of $100, $1,000, or $10,000. So it's kind of, scary too. And so you want to have a secondary insurance if you have original Medicare, but that's what the original Medicare is. And if you join a drug plan, the cost can be different, depends on which plan you have and also which medication you take. And plans monthly premium wise, the cheapest plan this year is $0 per month. And the most expensive plan is like $228 per month. So you really want to study which plan is best for you. And second option to receive your Medicare prescription drug is to join Medicare Advantage plan. And Medicare Advantage is actually called Medicare Advantage drug plan because it includes your drug benefits. And it's also known as Medicare Part C. And if you join a Medicare Advantage plan, you basically having your plan to manage all your Medicare benefits, and plans have a network of doctors that you need to work with. So it's not like you can go to any doctor you want. You need to see the plan's network doctor. And kind of visualizing what I said. So if you have original Medicare, you go to your doctor's office and you show your Medicare card, red, white, and blue Medicare card. And when you pick up your medication at the pharmacy, you show your drug plan's member card. If you have Medicare Advantage plan, you still have original Medicare card, but you keep it in your home at the same place. You don't wanna share your Medicare number to anybody, everybody, because it's really, private information. It contains private information. And so if you have Medicare Advantage plan, you show your Medicare Advantage member card at the doctor's office and also at the pharmacy when you pick up your medication. And Medicare Advantage plan, the plans must provide the same benefits as original Medicare provides, but they can add some rules, like, prior authorization is one of the things. And also, you need to have a referral to see doctors, to see specialists and so forth. And some plans offer additional benefits, and that's the reason why Medicare Advantage plan is getting more popular these days. Some plans, they give you gym membership, dental, vision, hearing aids, that's original Medicare doesn't give you. And also, like, some plans give you cash card that you can use on utility or gas or food, all that kind of thing. So Medicare Advantage plan is getting very popular, but you wanna see, if anybody offers you this additional plan, if you really can get it. Because sometimes we hear from our clients that, once they join the plan, they find out you have to have like a certain medical condition to receive that benefits. Or the, like, worst case, last year or 2 years ago, I heard that they joined the plan, they advertised the benefits not available in California to, have people join their plan, and they found out after joining that it's not available, it's only available in Arizona or something like that. So you wanna make sure before you join the plan, if there's any criteria, if there is any condition that you have to satisfy to get that benefit. Okay, so, and we talked about Medi-Cal's, before going that, I'm sorry. And do you have any question about the Medicare Advantage plan?
No questions? Well, actually, there is one question. Grab the mic and voice
The Medicare Advantage to Blue Cross, that's one of the things that I have.
Trying to figure out the percentages, each one.
Trying to figure out the percentages, 20%, I'm still a little confused on that.
Okay, so,
Is basic best?
That's to add.
so
Best add.
Medicare Advantage plan, they have different pricing structures from original Medicare. Instead of having co-insurance 20%, they have co-payments, and many plans, they have no deductibles. There are some plans comes with deductibles, but many plans have no deductibles, and they may have cheaper drug out-of-pocket costs, like for your prescriptions. They may cover more drugs, and they have cheaper out-of-pocket expenses on your prescriptions. So they have really different way of pricing their services. And the big difference between original Medicare and Medicare really compare how much you're going to pay when you need the services.
The $202 deductions for, what is that for? Does that transfer to increase the other? Will that increase or will that be the same?
So you're talking about these $202.90? Okay, so this is
Yes.
a monthly premium to have Medicare Part B as in boy. So you need to have A and B to join Medicare Advantage plan. So everybody basically needs to pay these premiums. And the thing is, there are some Medicare Advantage plans, they offer, it's called Part B give back benefits. And the plan pays a portion of your Medicare Part B premium so that you can pay less amount than this. have a fewer doctor that accept Medi-Cal only patients, but when you have both Medicare and Medi-Cal, more doctors would accept you, your appointment, because Medi-Cal doesn't pay as much as Medicare. So doctors are happy that they get 8%. And I said earlier, Medi-Cal will pay you a 20%, but it's actually not full 20%. They may pay really like a fraction of that amount. Maybe it could be $2 or $3 or something like that. So there are some doctors, they say, oh, I take Medicare only, I don't take Medicare and Medi-Cal patients. If that happens, you need to look for another doctor who accepts both Medicare and Medi-Cal. Because once doctors accept you, they cannot bill you. They are not supposed to bill you. You're not supposed to pay that bill too, but I hear some people, they still pay the bill because they want to keep the doctor, but it's supposed not to happen. So, your Medicare doctor doesn't need to have a contract with your Medi-Cal plan or request authorization to see you, because Medicare is your primary insurance, and that's the one decides which doctor you can see. And also doctor can say, I don't take Medi-Cal. I need to look for a different doctor. Okay, so when you have both Medicare and Medi-Cal, Medi-Cal will pay your Medicare Part B premium, that $202.90. So you will receive a letter from Social Security saying that the state will start paying your Part B premium, so you don't see any deduction when you have both Medicare and Medi-Cal. And Medi-Cal pays your Medicare co-payments and deductibles. So if you have Medicare Advantage plan, it still works. So if you have any co-pays to your plan, when you go to see your doctor, and if you have any co-pays, Medi-Cal will pay for it. And good thing about Medicare Advantage plan is, if you have both Medicare and Medi-Cal, the doctors must see you, a member, if you're a member of that plan, they must see you. They cannot say, oh, you have Medi-Cal now, I cannot see you. They cannot say that. They must accept the member. So it doesn't matter if you have Medicare and Medi-Cal or Medicare. Medi-Cal covers extra benefits not covered by Medicare, such as hearing aids and incontinence supplies, vision, transportation, and so forth. So you can get more benefits if you have Medi-Cal. And when you have both Medicare and Medi-Cal, you get financial assistance on your prescription drugs, and you are automatically enrolled into a program called Extra Help. And when you have an Extra Help program, you can join the $0 monthly premium drug plan, and there are 2 plans available this year. And in 2026, you will pay no more than $1.60 on generic drugs and no more than $4.90 on brand name drugs. So it can help you quite a bit if you have very expensive medication, because say if your brand name medication costs $500, but your out-of-pocket money is still $4.90. So the $0 monthly premium plan for this year, I said there are 2. So one is called Wellcare Classic, and the other one is Healthcare Assurance RX plan. It used to be called Cigna Healthcare Assurance RX plan. So if you don't have these, one of these plans, and if you have extra help, and if you want to save money, please give us a call. We can check if these plans cover all your medications, and then if it does, and also if your pharmacy is in the plan's network, then maybe you want to switch to one of these plans, because you can save money. Okay, and don't need to stick with the open enrollment period in the fall. So with this extra help, special enrollment period, you can switch your plan every month from Medicare Advantage plan to original Medicare, means prescription drug plan. And from, if you have a original Medicare already, you can switch from one prescription drug plan to another. And also you can switch from Medicare Advantage plan or original Medicare to, it's called dual special needs plan. It's for, it's a Medicare Advantage plan still, but it's for those who have both Medicare and Medi-Cal. So if you have dual special needs plan, this one plan will cover both Medicare and Medi-Cal benefits for you. So you don't need to juggle two cards to get all the services. And if you want to switch from one Medicare Advantage plan to another Medicare Advantage plan or original Medicare to Medicare Advantage plan, you need to use Medicare's open enrollment period in the fall. So I think they did this made this change, kind of restricting move from Medicare Advantage plan to another Medicare Advantage plan is because there are many fraudulent activities. Like we got calls from many people saying that their plan got changed and they couldn't see their doctors while they have ongoing treatment, and they didn't make that changes. Somehow, like somebody made the changes, and I don't know who did it. It could be the agent or whoever got their Medicare number, switch their plan because, you know, like say agent, when you help people enroll in a plan, they can get commission. So to prevent that kind of scenario, I think Medicare decided to implement this changes so that you can change from Medicare Advantage to original Medicare, but not from Medicare Advantage to another. Okay, and medical updates for older adults and people with disabilities. Starting this year, Medi-Cal will check your asset again. So if you're single, $130,000 is the asset limit, and married couple is $195,000 limits. And asset include bank account, cash, and anything over one home and one vehicle. And if you are an undocumented member and 19 years and older, you cannot apply for Medi-Cal now, this year. If you had Medi-Cal already, you can keep it, but you really need to renew it to keep your Medi-Cal status. And next year, starting January 2027, they are shortening the Medi-Cal retroactive period to 2 months. I don't know if anybody knew about it, but when you apply for Medi-Cal newly, you can ask Medi-Cal to backdate the effective date up to 3 months currently, but in 2027 it becomes up to 2 months. And this is, I'm not sure if this is that relevant for this group, but immigration status really matters now when it comes to Medi-Cal. And if you don't have satisfactory immigration status, and these are the satisfactory immigration status examples, if you don't have it, starting July 2026, dental benefits will no longer be provided to adult Medi-Cal members. You still can get emergency dental care, but not the regular dental benefits. And starting July 2027, $30 monthly premiums to keep full scope Medi-Cal if you don't have satisfactory immigration status. And what should I do if my Part D plan doesn't cover a drug I need? So this is like now I'm going to talk about the questions that frequently asked. And so if you change your plan and you find out your Part D drug plan doesn't cover your medication that you need, so you have some options. First thing is you can ask your doctor if you can switch to another it will be covered until the end of the year. And if you keep the same drug plan, you may need to do the same thing if the plan doesn't cover the drug you need still. Okay, and the next question is, I have been on Medi-Cal for a while, and Medicare just started this month. I noticed Medicare deducted $202.90 from my Social Security benefits, that's the Part B premiums. Do I really need to pay this? So the answer is no. If you have both Medicare and Medi-Cal, Medi-Cal will automatically start paying your Part B premiums. It may take a couple months, but it should start, and the amount you already paid should be reimbursed to you. But if this deduction keeps going more than like say 4 months or so, please give us a call so that we can check what's going on and we can help you understand what's going on. Okay, and next question is, my doctor's office is charging me the Medicare 20% co-insurance for an office visit. Do I have to pay the doctor? You know, when you have both Medicare and Medi-Cal. So the answer is no, it's illegal, actually illegal for the doctor to balance bill you. It's called balance bill for inappropriate billing. And so they are not supposed to bill you. They must accept the Medi-Cal bill as full. And if there is any amount that Medi-Cal didn't pay, they cannot bill you for that. And if it happens to you, please give us a call, or you can contact your Medi-Cal plan to ask help. And I think this is the last question. The question is, my doctor says that he cannot see me because he doesn't contract with my Medi-Cal health plan. Is this true? So the answer is no. Your Medicare provider, your Medicare doctor doesn't need to have authorization, or they don't need to have a contract with your Medi-Cal plan, because Medicare is your primary insurance. So as long as they accept Medi-Cal, Medicare, Medi-Cal, they can see you. And if they say anything more, you know, you can give us a call, and or you can contact your Medi-Cal plan, and we can explain that to your doctor's office, or we will refer you to the Medi-Cal plan you have and have them educate the doctor's office. Okay, so this is the end of my presentation. Do you have any questions? Yes.
So, well, people will ask you for help.
A little bit.
This is a little bit, I mean, it's a confusing topic, right? So what do you do?
So, please give us a call, and,
Okay.
yeah, then it's going to be one-on-one, so you can ask us any questions you want.
Okay. For Medi-Cal.
So for Medi-Cal, and children, what is the age limit for children?
I thought, you know, I am not 100% sure, but I thought 20 something. I can't. Maybe you should contact DPSS office to clarify that.
Okay.
so my mom, met with someone who came to the door, to the home, and was talking about Medicare, and they said that there were different, free things that were gonna be paid for, and was asking for her card number. And is that a scam? It sounds a little fishy to me.
I don't give out any of my personal information to anybody who knocks on the door. So, I don't know if it's scam or not, but I wouldn't give any information to the person.
Well, unfortunately, she's asking her to, repeat the sign. So my mom did give that information out, what did she do? Is that right?
So, well, she can give us a call, or she can contact Medicare and see if anybody switched her plan, or if anybody's charging her account, if anybody's charging any services that they said they provided to her. And also, there are this fraud going on really a lot in Los Angeles County. It's a hospice fraud. So sometimes people are put in hospice care. That's for people, hospice is for people who have terminal illness, and doctors advise that they have 6 months to live. And with hospice, you give up all the curative care and the treatment. Like say if you have cancer, you cannot get chemotherapy if it's going on, because you give up. You just wanna have comfort. That's the hospice care. And it's really going around, and if your mom can't see your regular doctor, you wanna doubt that too. You wanna suspect that too. So maybe she can give us a call and we can check what's going on, but she can contact Medicare as well and check if there is any activities going on her account.
One more question.
So, if it is the case that it was a scam, and maybe it was involved in this hospice fraud that you're talking about, then would my mom get penalized for that, or
No,
does she
she-
get punished at all, or would she have to pay something for that?
So, like say hospice, there is no co-pays or anything like that. It's much more like she cannot see her doctors. That's more, I guess, more serious. So she can report that to Medicare. She can file a fraud claim with Medicare, and also she can contact OIG, or there's another organization called Senior Medicare Patrol. Maybe I can give you their number too, but she can contact them and see if they can help her too.
Okay. Okay.
Question over here.
Another question from the audience, hold on, we're just trying to decide which one's gonna ask first, okay. So if I have Medicare, how much, do I pay for co-insurance? Like if I have to go to the hospital, for example, how much do I have to pay out, for the copay or the co-insurance?
So it depends on what plan you have. If you have original Medicare, you have like deductible, which is like $1,736 or something for day one, and then Medicare covers full from day 1 to 60. But if you have Medicare Advantage plan, it depends on your plan. Some plans you may need to pay deductibles, some you may not need to pay anything, or you pay some portion. So it really depends on what plan you have.
Another question from the audience,
DPS.
so DPSS, what do they do?
So DPSS, Department of Public Social Services, they manage Medi-Cal program in Los Angeles County. can apply for Medi-Cal, you can renew Medi-Cal with them. If you have any questions, you can contact them.
No, no, okay.
Okay. Okay. Yeah. I don't think I had a, for the. Yeah, sorry, I don't have.
Okay.
Any other questions?
No.
All right, well, thank you very much.
So I'll just close us out on our presentation today. Thank you so much for everyone who came and watched on the live stream. Hopefully you all learned something about some changes or different plans and you can make preparations for yourself. And thank you so much, Ria, for coming and sharing your information and for your time. Thank you for the interpreters and their services. And thank you to everyone in attendance.